The time has come to select an EHR for your practice. With so many options available, identifying one that meets your practice's needs may feel overwhelming. Let's see if WRS Health is the right fit for your practice. To start, our fully integrated cloud-based electronic medical record and practice management solution is designed to remove the silos that may occur between your front desk, clinical, and billing staff. Data flows through the EHR without interruption, without delay, and without effort, ensuring efficiency and consistency across your practice. WRS Health certified software is structured around a 4-step workflow where each module connects with one another to ensure practice success and optimization so you can focus on what you do best, patient care. Now let's get started. As with all appointments, the patient's experience starts before they enter the waiting room. With this in mind, the first step of our 4-step process strives to help your front desk provide excellent service and foster good relationships with your patients. In this example, we'll use a new patient, Sarah, who's trying to book an appointment with Dr. Smith. When adding Sarah into the EHR, the front desk is prompted to only enter the necessary information needed to register a patient, streamlining their intake process by reducing the amount of questions Sarah needs to answer. To schedule Sarah's appointment, the front desk will simply drag and drop her name onto Dr. Smith's calendar at the desired time. Here, the staff will be able to assign the appointment type, as well as send an appointment confirmation to Sarah automatically, all with one click. Sarah will also receive instructions on how to complete her registration on the patient portal. She can complete the registration at her leisure anytime before her appointment. When accessing the patient portal, Sarah is prompted to enter medical and family history, habits, current medications, and any allergies she may have. This information automatically flows into the EHR, eliminating the need for it to be collected by office staff on the day of the encounter. Sarah will also be able to enter her own billing and insurance information. Once this information is entered, the system automatically checks Sarah's insurance eligibility 24 to 48 hours before her appointment and confirms her coverage in real time, reducing the possibility of claim rejections later in the process. It will also ensure Sarah will pay the correct copay amount for her visit, so she's not surprised by any charges later on. Now that we have all the necessary information needed from Sarah, let's move on to the day of the appointment. 1 hour before, Sarah will receive a link to the check-in module that allows her to confirm her demographic information, enter her preferred pharmacy, and pay any copays that need to be collected. She will also answer specialty-specific questions regarding her review of systems that flows into the chart for that day's visit. Collecting this information during this time will help free up Dr. Smith during the appointment, so he doesn't feel rushed entering this information, improving Sarah's experience and care. As Sarah arrives for her appointment, the front desk staff can officially check her into the system and review if any outstanding information is needed on her behalf. While Sarah's in the waiting room, Dr. Smith can review her medical history that she entered in the patient portal and check-in module. When Dr. Smith is ready to see Sarah, the front desk staff will select Move to Exam Room. Moving a patient to an exam room automatically creates the encounter note for that day's visit, which is pre-filled with all the information entered in the patient portal as well as the check-in module. With this information already available, Dr. Smith's time during the visit is cleared of any manual data entry, so he can build a good rapport with Sarah since she is a new patient. He'll have time to listen to Sarah's story and uncover what is truly affecting her health. While listening to Sarah's present illness, Dr. Smith can easily document by various methods of free text, dictation, or customized templates. WRS Health learns the way he charts and develops knowledge from all users on the platform. The system stores Dr. Smith's favorite and most commonly used diagnoses and procedures and will present them as defaults to him for easy selection. Also, connectivity with SureScripts and CoverMyMeds helps Dr. Smith check drug formulary and possible interactions before he electronically sends a prescription to the mail order or retail pharmacy Sarah confirms earlier in the check-in module. Now that Sarah's visit is over, it's time to check out. The front desk is prompted to collect any additional fees, reducing the possibility of any patient aging occurring. If a future appointment or printed referral letter is needed, it can be completed simply with a few clicks. Also, any educational material related to her diagnosis will automatically be sent to her email. Once a note is signed by Dr. Smith, a biller is able to start working on a claim. All actions that occurred in the 4-step workflow beforehand set the stage for a healthy revenue cycle, meaning all services rendered will be completely, correctly, and promptly billed, and all claims billed will be completely, correctly, and promptly paid. The system will not allow the biller to send a claim with missing information, and it will give them a warning if CPT codes cannot be billed together, modifiers need to be appended, or ICD codes are missing. All the biller has to do is ensure that the claims are scrubbed according to the insurance billing guidelines. The clinical and front desk staff are not the only ones that benefit from pre-populated information. When viewing the actual CMS 1500 form, the biller will see the patient demographics and insurance information entered by Sarah, as well as the date of service, CPT codes and ICD codes, and modifiers from the EMR note by Dr. Smith. Even the tax ID, billing location, and billing NPI are pre-populated based on the billing setup done during implementation. The biller can see the information that will be sent to the insurance company, thus making it easier for them to determine which box needs to be corrected, in the chance the claim gets rejected or denied. Without any redundant charting or low-level data entry to complete, the bottlenecks that used to plague Dr. Smith's practice workflows have been eliminated. Both he and his staff can amplify the time they spend on true patient care, and they now view technology as an advantage rather than an impediment. Now that you understand how our modules connect and benefit from each other, let's talk about reporting. As a growing practice, you need real-time information that is actionable. WRS Health provides a suite of reports that run automatically and at intervals set by the practice. For example, daily collection, clearinghouse, and patient statement reports. These reports and more instantly present all the information that the billing staff require to expedite, correct, and complete payments from all insurers and patients. There you have it. WRS Health systems, processes, and tools improve patient care and amplify a physician's talents by offloading transactional elements and the clinical gathering of information through systemization and automation, all while putting in place the building blocks needed for a healthy practice to realize its full potential. Find out if we are the right fit for your practice. Schedule a practice assessment today.